So my name is Dr. Daniel Derbyshire, and as Jane said, I'll be talking about unconscious bias in the workplace. Yes, can you go to the next slide, please? Do my best Chris Whitty impression. So first, to just give a bit of context, as Jane already alluded to, there was some new labour market statistics out yesterday, and they show that disabled people are more than twice as likely to be unemployed compared to non-disabled people. That's been a consistent gap over the last 8 years, which is when kind of government reporting, the way in which they report things changed, and so previous data isn't comparable. But that gap has narrowed a little bit. It was almost 2 to 3 times, 2.5 to 3 times as likely to be unemployed about 5-6 years ago. So some progress, but still a significant unemployment gap. And so unconscious bias is cited as one of the major barriers to employment for people with for disabled people. And just to try and link it back to the work that Ishmael's just discussed, this often manifests itself as stigmas, stereotypes, and incorrect assumptions. Some of the most common ones you can see from Ishmael's disability map there on the right-hand side. Fear of extra time off, which again Ishmael mentioned explicitly. Fear of regulations, are you doing the wrong thing? Fear of costs, fear of costs of making adjustments, productivity concerns, and other unknown risk aversions, etc. And now, in any given context, for any given job role and person, one or more of these may be more or less valid concerns, but I think on average that they're mostly overstated. But of course, in any given context, there may be specific productivity concerns or things like that. Can we go to the next slide, please? Sorry, just keeping an eye on the time. So just to give an overview of unconscious bias in the workplace and how it can affect the workplace. So I think that there are a number of kind of decision points in the employment life cycle, if you like. And that goes from, this is from the employer's point of view. So the employers will have to choose who to interview and or shortlist. They'll have to choose eventually who to hire for that role. They'll be choosing who to give training and development opportunities to, choosing who to promote, and in unfortunate times, choosing who to retain and or let go if times get bad. So all of these points in the employment kind of journey for people involve the employer effectively choosing between people. They've got multiple people they can choose and they have to pick one of them, right? So at all of these kind of steps, there is the potential for unconscious bias to come in when you're looking at a group of people and having to pick one or maybe two if you've got 2 roles, etc., or you can offer training and development to more than one member of staff. But often, especially as SMEs, you'll be resource constrained, and so you'll have to pick and choose who to offer training and development opportunities to. These things can then, especially these latter 3, can then really feed into each other, because who you offer the training and development opportunities to is going to affect who is the most viable candidate for the promotion when those promotions come up. Who you offer the training and development to is also going to affect who's most likely to be let go if you need to let people go because they haven't got the skills. Well, you didn't offer them the chance necessarily. And so I think that this is just an overview of the kind of things where we can expect unconscious bias in the workplace to kind of emanate from. These are the kind of points at which it can really bite on people's work experience. Can we go to the next slide, please? So just to give you an overview of the research that I've been doing, we use a well-validated measure of implicit bias against disabled people specifically, with the local business community. And we had just over 100 people take part in total. And so they do this implicit bias measure, which gives their implicit bias against disabled people, and then 2 kind of complementary surveys that go with it, one about their employment history, status kind of thing, and again, a well-validated health-based survey known as the EQ5D for those who know. When we were looking to get people to take part, we explicitly targeted SMEs, people from SMEs, which is obviously the inclusivity is kind of raison d'etre, so makes sense from that point of view. And we also targeted people who are either HR professionals or decision makers, and I put decision makers there because clearly in the SME context, having an HR department is much less common. And so they often won't have HR professionals. So in the context of an SME, I'm talking about the person who makes the hiring decisions, which is often just the owner and or manager. So can we go back a slide for a second, please, Mr. Sorry. And so if you look again at this list of things of the decision points that people have to make during this employment journey, you can see that in a large firm, these will often involve multiple people. So you'll have a committee that chooses who to interview. You'll have a committee conducting those interviews, or a panel conducting those interviews. You'll have an HR department choosing who gets training and development opportunities, who gets promotions, etc. Whereas in an SME, actually often these will all be done by the same person, and that person is the owner or manager of the SME. And that person is often actually making all those decisions on their own rather than in a group or a team. And we know from previous research that when people make decisions on their own, they're much more likely to exhibit unconscious biases compared to when they make decisions in groups, especially in diverse groups. And so this is one of the big differences between SMEs and large companies. And so we thought, when we were kind of planning this research, that actually there may be much more unconscious bias in SMEs because there's less team working, etc. Can you skip forward 2 slides then, please, Mr. Back to where we were? Perfect, yeah, thanks. And so in terms of our results, we do find significant levels of bias against disabled people. This is in line with previous research with like general population samples, and it's also consistent with previous research on implicit bias in the workplace against different races and against gender as well. And so there's a significant body of evidence about unconscious bias, both in the general population and in workplace contexts. But we were the first people to use the disability version in the workplace context, and so kind of filling a gap there. Despite what I just alluded to, we don't find any significant differences between SMEs and large firms, so they have the same levels of implicit bias. That's despite significant spending by large firms in particular on quality, diversity and inclusion initiatives, unconscious bias training, which I'll come back to. Similarly, we don't find any difference between these HR professionals, which I put a star next to because this caveat about people who make hiring decisions being more applicable for the small, medium enterprise context. And so again, people who work in HR professionals who make hiring decisions, who you would expect, who we had expected previously to doing the research, to be more well versed in, for example, the law, the Equality Act, all this kind of stuff in terms of unconscious bias, inclusive recruitment practices, etc. And so we thought there may be some difference there, that they're more aware of unconscious bias, etc. But again, we don't find any difference between them. And again, so there's no difference between large and small firms, no difference between people who do make hiring decisions and people who don't. One of the interesting things as well, actually, is that we find that disabled people are underrepresented, particularly in the higher levels of the workforce. So of our sample of just over 100 people, 23% reported having a disability, which is maybe slightly above the national average of about 20%, but it's basically in line with it. Whereas only 6% of those disabled people said that they were involved in making hiring decisions within their workplace. And so compared to non-disabled people, where it was about 18 to 20%. So non-disabled people are about 3 to 4, in our sample at least, about three or four times more likely to be involved in making hiring decisions. And so what we find is that disabled people basically aren't involved in the decision-making process of who to hire, who to fire, etc. And so it's not a surprise then in that context, that's not being reflected in the hiring decisions, the promotion decisions, etc. Can we go to the next slide, please? Which I think is the last. Yeah. So now just to kind of give a sense of what to do, or what this all means. So I think that there's 2 kind of key reports which I found when I was starting to look at this. One by the Equality and Human Rights Commission on unconscious bias training and whether it works effectively, basically. And then another one by the Behavioural Insights team, which was a former government department that got spun out a few years ago. Used to be called the Nudge Unit, for anyone who knows. On unconscious bias and diversity training, so a bit broader than this one, which is just about unconscious bias. But again, it's about what the evidence says in terms of effectiveness. And both are quite scathing in terms of the effectiveness of unconscious bias training. The evidence for its effectiveness is rather limited. And there are a couple of reasons given for this and a couple of suggestions of ways that we can kind of move forward. One of which is that there's a huge variation in the quality of provision of what we call unconscious bias training and the content as well. And that's because at the moment there are no accreditation standards or minimum standards or kind of professional qualification that says you know how to deliver unconscious bias training effectively, etc. And so, like I said, there's a lot of money being spent on this, but actually there's also kind of a lot of money being wasted, I think, on poor quality unconscious bias training and or equality, diversity and inclusion initiatives. And so what the problem with this is two things. One, it decreases confidence in the market. People think, because there's some rubbish unconscious bias training out there, people think all of it's rubbish. And the other thing it does is it makes proper evaluations of the effectiveness very difficult, because you're often comparing apples with oranges. That was a really good unconscious bias training and it worked. That was a really bad one and it didn't. Well, is that because it doesn't work? Or, lots of different questions there to unpick. The other point is that more evaluations of unconscious bias training are needed in general. I think that usually when businesses spend money, they expect some kind of return on their investment for all of their spending, but including their staff training and development budgets. They expect staff to gain professional qualifications or specific software competencies when they send them on training and development courses. But I think when it comes to EDI or unconscious bias training, there's kind of a sense that it is in itself the outcome, whereas there's no effective tracking of, did that unconscious bias training that you spent a lot of money on or a lot of time on, did it reduce anyone's bias? Has it changed anyone's behaviour? And so there needs to be a much more systematic approach to evaluating whether our efforts in this space are working. And if they aren't, then we need to rethink them, obviously. And so in general, we need much more research on what works in this space, in what context, i.e. when, and the causal mechanisms behind that. Why does it lower bias? The two things we want to do are lower bias and change behaviour, right? So we need much more evidence on the kind of the mechanisms behind all of this.